Each hip that's replaced, each broken bone mended, makes a hospital a fee. But compared to 5 years ago, they now get 20% less money for doing the same work. Hospitals often now spend more on patient care than they earn from it. The result, an eye-watering deficit. England's NHS Trusts have ended the year almost £2.5 billion in the red.
The savings that that the system has been asking for hospitals to achieve is simply undeliverable. And if you ask for an undeliverable target, you then mess up the finances, which is exactly what's happened.
From a surplus 4 years ago, the financial picture worsened rapidly. But even so, the latest deficit is on a different scale altogether. Employing agency staff cost over £1 billion more than hospitals budgeted for. They paid £500 million in penalties for missing waiting times targets, while so-called bed blocking also cost them dearly.
Well, they are going to be deep-seated problems that'll take a number of years to eradicate. There's a significant increase in NHS funding this year, and that should reduce the deficit by quite a lot. But we also are working on a multi-year programme to drive out inefficiency in the NHS and reduce variation between the most efficient and inefficient hospitals.
The picture would have been even worse, but hospitals have come under intense pressure to minimise their overspends. To keep their debts as low as possible, hospitals have had to plunder their budgets for basic maintenance, things like repainting the walls, building new facilities or replacing broken equipment. Like many trusts, Ipswich Hospital is determined that cutting costs doesn't impact on patient care or safety.
There are clearly some choices that we do need to make, but I mean, one of the things that I think is incredibly important is that we do retain the quality of the services that we're seeking to provide. Certainly in my view, I think there are some areas where we could improve on our efficiencies and reduce costs, and some of those areas we're going to be concentrating on, and that's not going to be at the detriment of patient care.
But with a record number of people waiting for operations and key targets breached across England for cancer care, A&E and ambulance response times, trying to get back into the black can only be painful. Catherine Jones, 5 News.